Hello and welcome to Tea Talks with Total Health. Today I'm going to be presenting an excerpt from our recent ASCO Direct conference held in Memphis on August 12th and 13th. This was originally presented there at the conference by Sami Mansfield, who works in exercise oncology and lifestyle medicine space. The topic again is cancer wellness in communities of color. However, this pertains to all communities. All right, so what do we know? There's a higher mortality in the African American community, and we know that, for example, Black women, African American women, are 40%. They're 40% more likely to die from certain cancers than white women. We also know that in African American community, colorectal cancer is 20% more likely, more diagnosed, and 40% more likely to die from it. So that's what we know, and there's many reasons for it. We can't cover them all here, but here are some of the topics that was covered. There's less likely to follow screening and prevention guidelines. Why is that? And I think this is a general statement, certainly not unique, certainly not for every pertaining to every African American out there. However, generally speaking, there is distrust in the system. On the African American people of color side, there's also inherent fears. So there are a lot of reasons why African Americans or people of color get diagnosed later. And of course, we know that the later you're diagnosed, the worse your outcome. There's some increased practical barriers. We know that there's financial barriers. We know that there are cultural barriers. We know that there are a lot of social determinants of health in that particular community. Because as I mentioned again, cultural and social barriers. Of course, we know that there is an underrepresentation of African Americans and people of color in clinical trial and clinical research. It's a dream that we all have to see more people of color represented in these trials. One of the reasons why Total Health is having their own clinical trial, which will be enrolling majority Black women, and that will be announced, later on this year. So this is what we do know as to why, there are so much, poor outcomes in this community. All right, so what do we do? What can we do about it? Okay, here are some tips that Sami brought up that we could do. If you are a cancer patient, seek out morning light, for example. Get exposure to sunlight for 10 to 20 minutes or 10 to 30 minutes a day, walking, or even just sitting on your porch. Someone actually said if you have to work from home, take your laptop, right, and sit on your porch, get some sun while you work. Set up a dark, cool room for sleep using blackout curtains, sleep mask, etc. We all know the importance of sleep. And unfortunately, many times people of color, and again, I hate to sound general, but sometimes people are juggling 2 and 3 jobs, even while they have a cancer diagnosis. And so sleep is sometimes hard to come by, but obviously very important. Create a space only used for sleep or sex. In other words, do not have a television if you can avoid it in your room. I recently made that decision. I've always had a television in my room, always. But 2 or 3 months ago, I removed the television from my room, and it's made a huge difference into my sleep habits. Avoid caffeine intake after 2 p.m. Sometimes hard for folks, but decaf is not that bad if you make a switch. Avoid caffeine or caffeinated drink. Even if you're drinking that wonderful green tea, there are wonderful decaf options available. Reduce engaging or participating in stressful activities or experiences within 30 minutes of sleep. And I would say this also includes reducing the types of show that you watch that may create anxiety or stress before bedtime. A good way to do that is to tone down with maybe like a good book. A good book sometimes makes you fall asleep. So, all of these strategies that we're discussing on this particular slide is how to help you get better sleep, because when you sleep, it's going to improve your outcome, it's going to improve your health. Drink a glass of water upon waking up to rehydrate what our bodies lose overnight. Here's just some lifestyle tips and strategy. And again, this is not just for people of color. This really is for anyone. Lifestyle medicine habits. Okay, so sometimes I heard a doctor said recently on one of our tea talks, it's very hard when someone's diagnosed to get them from where they were in their diets, in their habits, and to bring them to where you'd like them to be. For example, if someone was a person who ate meat, it's hard to say, well, because you now have cancer, because you're now diagnosed, you're going to have to become vegan. It's very difficult. It's not very practical. However, and of course, if you are someone who is sedentary, to now say, well, exercise is the magic bullet right now, weightlifting and, getting your cardio. It's hard to go from sedentary to being a Tabata expert. However, what Sami mentioned was take simple, small steps, make simple, small changes, right? Simple, small changes, and be consistent. Do it often. So, for example, if you were not a walker, you could just start walking for 5 minutes, start small, but then walk every day if you can, or walk 5 days a week, even just starting out with 5 minutes. So it's important to take care of your mind and body. It is the only place that you have to live. And so she talks about the power of tiny gains. What was really interesting at the conference is that Sami was able to show us that in how much you can actually do in 5 minutes, even while sitting. Many people work from home and many people have sedentary jobs, but there are things you can do, exercises you can do in your chair. You just have to be intentional about moving your body. Strengths for wellness in communities of color. Now, the first point she had there was being resilient. And I just want to say the word resilient, I like that word over strong. There is this feeling, and I know a lot of many people in the African American community do not like the term strong Black woman, because it's a double-edged sword. Because the perception of a strong Black woman sometimes means that you don't get treated equitably, because it is assumed that you're so strong you can tolerate more pain, more suffering, etc. So I like resilient because it more speaks to bouncing back. Okay, bouncing back from trials, from hardships. So there's, Sami was mentioning that there were some strengths for wellness in communities of color, which we should tap into, or resilience, family and community bonds. I know in my particular family, for example, we tend to live in pockets that's near to each other. We tend to be near to each other. A lot of family gatherings, every holiday we're getting together. So that's a strength that's in the communities of color for sure. Spirituality and faith, it's huge. I mean, I speak about this a lot, even when I'm speaking to oncologists. Like, listen, faith and spirituality are huge pillars in when it comes to the people of color, and how we view our health and how we view our healing. That honestly, it's really, in many cases, it's faith first and science second. Positivity and optimistic outlook, it's true. Especially if you're in community, if you're in with your family and you have the right family members around, there's generally more of a positive and optimistic outlook on your situation. Cultural pride, Sami listed it as a strength. People are proud of their heritage. And activism and change, again, the African American and people of color have always been in a fight, always been in a battle for rights. And so it's part of our DNA to always be seeking change, change and being part of that change. She mentioned there were some simple questions that you as a practitioner could ask your patients, right? Simple coaching questions that honor social determinants and health equity. just asking people how they're feeling. How would they, how to pronounce their name? What would they like to be called? Ask questions as practitioners, nurses, doctors in the oncology space. I think in any health space, ask. Don't just tell people. Don't just tell these patients. Ask questions. Consider their practical barriers. Consider that it may have taken them 3 buses to get to your practice. So consider the practical barriers that people are facing. Provide strategies that are both practical and accessible to these to your patients. So ask questions and ask from a space of empathy. We should also talk about social connectedness. The benefits of social connectedness was, she says, improved quality of life, health span, and your lifespan. So we talked on the slide before about the power of community, and it's the power of connectedness. And the community does not have to be your family. It could be a church group. It could be a club. It could be a sorority. It could be a fraternity. It could be, wherever people hang out that has common interest. So there are benefits in being in community, especially when you're going on this journey of cancer. It is shown that social connectedness has when you're connected, it impacts obesity, smoking, and high blood pressure. That means that it has a positive impact on those things. Maybe when you're smoking, maybe you'd smoke less when you're in community, because not everyone smokes. So it's, you smoke less. And of course, when you're calm and your stress levels are down, then of course your blood pressure will also go down. And there's a decreased risk of depression, anxiety, and suicide. I actually read something about that today, where the younger people being diagnosed are, they're more prone, when they're isolated, they're more prone to having anxious thoughts, suicidal thoughts. And so if they can be in community, there's just a decreased risk of all of that. And so what are some of the barriers? Time, distraction, obligation, right? And so one of the things is that came through this weekend is you have to make time for yourself. You have to make time for self-care. You have to make time to be healthy. And as we come up to, I believe this is our last slide, it says set time limits for social media. Set time limits for social media. For example, I usually take a social media break from 6 p.m. Saturday to 6 p.m. Sunday. I just take a break. This was hard for me because my work is on social media, but it allows my brains to cool off and allows me to be more present with my family. Identify someone you feel authentic with. So if that's a good friend, if that's a relative, someone who you can just say how you feel. Identify that person. I was blessed that when I was diagnosed, I had a couple people who I could just be authentic with, who I could just explain that I wasn't feeling powerful today. I wasn't feeling strong today. I wasn't feeling like a leader today. I just wanted to feel like just a person going through a difficult time. So identify someone you can be authentic with. Practice 5 to 10 minutes of mindfulness per day. Music, walking, nature. Listen, if you're at a place where you can even take your shoes off, right? If you have a park nearby that you could take your shoes off and feel the ground, feel nature, get yourself grounded. Practice that mindfulness per day. For those of you who are, again, we talk about people of color, for those of you who are people of faith, read your Bible, read a good book, journal, just take that time before you get up and hit the ground running for work. Because again, cancer doesn't mean you stop working. People are working while they're going through their diagnosis. But this presentation is to help you manage all of that, manage your lifestyle, manage your stress levels, and just regroup. And it says, join us a group that fits an area of your interest outside of your professional self. So a lot of times we tend to, stick with our trade groups or professional groups, but find a group that's so different from what you would normally, who you would normally connect with. And because what I find is that the more you can learn something new, it's almost distracting, right? It's the more you learn something new, it's the more you're distracted from the anxiety and the worry. So these were some tips that Sami shared at ASCO Direct in Memphis, and she will be actually presenting again at our Evolution Conference on September 30th and October 1 in Boston. So it's for women only. It's women in oncology space. If you are a woman in oncology, any form of it, we invite you to check out our Evolution Conference coming up in Boston. I'll be speaking there as well on couple topics, and Sami will be sharing as well on these lifestyle tips and strategies. As always, we ask that you leave your questions in the comments, and we will answer as soon as we see those. So thank you for watching, and thank you for watching and supporting Tea Talks with Total Health. Take care.